Good afternoon, everybody. Welcome to our press briefing about COVID-19 in Tippecanoe County. I am the County Health Officer, Dr. Jeremy Adler. I'm joined by Commissioner Tracy Brown, Lafayette Mayor Tony Wojciechowski, West Lafayette Mayor John Dennis, Dr. Dan Wickert from Franciscan, and Dr. James Bean from IU Arnett. With the Stage 5 of Governor Holcomb's Back on Track Indiana plan approaching in the next few days, and also with the very significant increase in COVID-19 cases that we're seeing around the country, I think it's a good opportunity for us to take a look at how things are going in our county and to think about what direction things are heading and what steps all of us can take to continue on the right path and keep things moving in the right direction. The slide behind me is a snapshot of COVID-19 here in Tippecanoe County. This slide shows the number of new cases of COVID-19 every day since the first case was confirmed on March 18th through yesterday, June 30th. And you can see that the number of new, the number of new cases peaked at the beginning of May, slowly declined from then, but in the last week, the number of new cases has started to increase again. So whether this increase is just a bump in the road or is a sign of what will become an ongoing trend, we just don't know at this point. But one thing that's very clear is that COVID-19 is not over, that we're not out of the woods yet, that this disease is still with us and will be with us for the foreseeable future. So what we all need to do is we need to make sure that we are acting appropriately and responsibly so that we can protect ourselves and others in our community. So that means that we still need to be maintaining our social distance of 6 feet when we are out in public. We need to be wearing face coverings when we're in public, especially in places where social distancing is difficult to maintain. We need to continue frequently washing and sanitizing our hands and disinfecting frequently touched surfaces. Businesses should continue to modify their operations and their workplace environments to optimize social distancing, and we are encouraging businesses to establish policies requiring face coverings in their place of business. For folks who are 65 and older and have other chronic medical conditions, we are advising that they limit their time outside of the home as much as possible. In addition, for individuals who do become sick, please stay home. Please do not go to work or other community events while sick. This next slide shows the current case data for Tippecanoe County. As of yesterday, we have 640 confirmed cases cumulatively. We have had 296 individuals who have recovered from COVID-19. In the absence of a national or state definition of recovery, we created our own definition, and that definition is at least 28 days have passed since diagnosis. An individual cannot be currently hospitalized, and their symptoms have resolved. So when you're looking at our recovered numbers and also our deaths, which are at 8, we see that we have 336 active cases in the county. We've had 219 new cases in the last 28 days and 96 new cases in the last 7 days. So clearly, this illness is still with us, this infection is still with us, and we need to do all the things that we've been talking about for the last several months to keep our county moving in the right direction and to avoid a situation like we're seeing in other states. This next slide is simply another way of looking at the new case data. As you notice, the number of new cases does fluctuate from day to day. It goes up and down. So this is another way of looking at that just by taking the average daily new cases by week. And as you can see, in early May, that peaked at 12.9, decreased from there, but this past week it's gone back up to 11. So this is data that we'll be watching very closely over the next several weeks. In addition, our local emergency department visits for respiratory illnesses have increased. These are the numbers by week going back to early May, and you can see a steady increase in those numbers. For last week, there were 231 visits to local emergency departments for respiratory illnesses. This is another one of the data points that we are following very closely at the health department to track the COVID-19 situation in our county. Our largest affected age group remains individuals aged 20 to 29. They account for 22.8% of our COVID-19 cases. We have had 12,485 COVID-19 tests performed in our county. Our percent positive rate for our county is 5.1%. This is lower than the state, which is at 9.4%, and lower than the national figure of 6.4%. The World Health Organization has established 5% or below as a goal, so we're at 5.1% currently. We currently have 13 COVID-19 patients who are in our local hospitals. 6 of them are in the intensive care unit, and 5 of those individuals are on ventilators. We are very fortunate in the community to have an Indiana State Department of Health testing site that provides free testing for COVID-19. This testing site will be moving to a new location as of July 6th. It will be moving to the Durgan Elementary School, which is located at 1840 South 18th Street in Lafayette. The hours will remain the same, Monday through Friday, 8 a.m. to 8 p.m. Testing is free and no appointment is needed. Testing is for anyone who wishes to be tested, whether they're symptomatic or asymptomatic. So this is a very nice resource that we are very fortunate to have in our community. That concludes all of my planned remarks for today. We'd be glad to take any questions from the media and from our Facebook Live audience.
Hello, this is Anna Darling from WLFI. Was wondering if any of the most recent, or if any cases in the past month have come from people traveling out of state and bringing it back, maybe saying going to Florida and bringing it back here.
That's a great question. I don't have that information with me. I can check with our contact tracers and find out if that's been the case.
Question from Dave Binger. Are you hoping Governor Holcomb slows the final step of Indiana's reopening?
Well, yes, I am. I think when we look at what's happening in other states, it becomes very clear that as we progress through reopening, that we could see a significant increase in COVID-19 cases. So my hope would be that, based on what's happening in other states, that the decision would be made to slow our reopening process down and of course, continue monitoring our situation here in Indiana very closely.
Question from Facebook Live. Do you have any idea on how schools are planning to reopen?
Well, the schools have met with the health department. We've provided them with recommendations and some guidance about school reopening. Those recommendations and guidance were consistent with the Department of Education's guidance and also the guidance from the CDC and the State Department of Health. The schools are in the process of finalizing their plans, and from what I understand, they should be releasing their plans sometime within the next couple of weeks.
Anna from WLFI again. Is there any update about cases at the local Olive Garden? We've had reports from viewers that there are potentially up to 5 people that have been positive, and just want to know if there's any update on that specific restaurant.
Sure. The situation there is actually there has only been one confirmed case, and the individual who tested positive did not work while symptomatic. Other staff who have been tested there have tested negative, and so because the individual who tested positive did not work while symptomatic, there is really no risk to other individuals, including customers.
Question from Dave Banger. Do you believe Greater Lafayette is bound to get a surge as they've seen in some parts of the state and country?
Well, I think that really depends on what all of us in the community do. If we can stay strong and stay vigilant and do the right things, practice our social distancing, wear our face coverings, wash or sanitize our hands frequently, stay home when we're sick. If we can do those things, we have a good chance of preventing a large surge like we've seen in other parts of the country. But what's happened in other states, though, is a very stark reminder of just how easily this virus can spread and how easily things can quickly take a turn for the worse.
Do you happen to have any information about where within our county geographically the most cases are? Is it more like Lafayette, West Lafayette, outside the county or outside the city limits?
That's another excellent question. We actually don't look at it that way because what we know is that we have community-wide transmission of COVID-19. And so COVID-19 is occurring everywhere in our county. So we can't say that it's in one particular area of the county versus another, one side of the river versus another, because the illness is there, it's everywhere, and so there is a risk everywhere.
Question from Dave Banger. Can we expect an extension of the local restrictions on large public gatherings?
Well, I think a lot of that's going to depend on the decision that Governor Holcomb makes regarding whether we as a state progress from stage 4 to stage 5. If the decision is made to progress to stage 5 and large gatherings are then allowed, certainly we as a health department would recommend extreme caution and serious consideration about whether it's safe to have a large gathering. And if it is going to occur, then certainly significant modifications and plans need to be made to help lower the risk of transmission of COVID-19.
Jordan from The Exponent. Just wondering, how can we reconcile extreme caution with a holiday that he chose to open the state essentially fully open back on?
Well, I think it comes down to each of us doing the right thing, each of us acting smart and responsibly about what we do. We need to do these things to protect ourselves, to protect our families, to protect our neighbors and our friends, our community. And I think that we all need to approach the holiday weekend with caution and make sure that we are doing the right things.
I would like to hear from Dr. Wickert or Dr. Bean about if there's any concern within the hospitals about the kind of slight increase in cases we've had over the past week, if that trend will continue.
I'll go first. Yes, I'm concerned. So as Dr. Adler described, the county's numbers have shown an increase. We're certainly seeing that within our facility. Hospital is busy. We have 15 patients currently, 10 under investigation, and 5 with disease. But the volume is not coming from that group of patients only. We have other illnesses and many, many patients who are there from deferred care. So the story we've been telling every other week for a while now. But, so your question was, am I concerned with an uptick? Are we concerned with an uptick? Yes, we are. And I think that the concern about the moving to stage 5 over a holiday weekend, I think when that plan was established, there was perhaps optimism that we wouldn't have this background level of disease persisting. And so here we are, and we do. And so absolutely the recommendations that Dr. Adler has made about mask wearing and hand sanitizing need to be doubled down on. And yes, I'm concerned.
We also have seen an increase in our numbers in the last week, uptick in cases. We're probably seeing, I heard today, we're seeing probably about 15 to 25 individuals in our emergency rooms every day with respiratory complaints. We typically were running around 5 positive individuals. We're now up to 9 with another 12 suspect or people that we're investigating. So we've seen our numbers go up. And both hospitals are seeing the same element about not just COVID patients that we're having and seeing, but we're also busy with other individuals who have other illnesses, and we've expanded our elective surgeries, which is added to the individuals who stay overnight and stay in the hospital. So I think both hospitals are busy at this point. Yes, we're concerned. I mean, if you look around us, all around us, it's going way up. And so for us to say, well, we'll be the bastion, that'd be great. We hope that's the case, but it does concern us.
Question from Facebook Live. Why can't we require masks in public places like other counties in Indiana have done recently?
Yeah, that's an excellent question. And what we are doing in Tippecanoe County is we are letting our data guide our decision-making and our recommendations. And certainly we are watching our data closely. As I described earlier, we've seen an uptick in our new cases, and we'll be watching that closely along with the other data points that I mentioned. And based on that data, we will make additional recommendations, perhaps requirements, if necessary. There are any number of additional recommendations that could be made depending on how our data continues to look in our county.
Question from Dave Banger. This is for the mayors and Dr. Adler. How did the meeting go between Purdue, the cities, the health department, and local landlords and property managers? What was asked of them, and do you believe will they be able to meet those requests and expectations?
Sure. The meeting I thought went well. Mayor Dennis and I participated. It was a virtual meeting, and there were officials from Purdue who are involved in the Protect Purdue plan and also involved in the outreach with off-campus housing folks in West Lafayette and Lafayette. The main topic at the meeting was steps that property owners and landlords can take to make their properties as safe as possible for their tenants. So we talked a lot about CDC guidelines on shared and congregate housing and how those guidelines apply to the common or shared areas in apartment buildings. Also, we spoke about what would happen if somebody tested positive, how would that isolation take place, how would individuals who are close contacts be quarantined. So there was a good discussion of these topics, and I thought it was a very worthwhile meeting.
And to that point, there is a high degree of willingness on the part of the landlords and the property owners to make sure that they stay in business. I mean, to them, it's a matter of economics. Now, they're not, they're very compassionate about who they're renting to, and they want to make sure that they're healthy. But they are bending over backwards to comply, to make sure that the Purdue plan, the city of West Lafayette's plan mesh together, and more importantly, that the students are not just aware of what to do, but they're passionate about making sure they do the right thing. Again, we're always going to have an element that just says, not me, or I don't care. But right now, from what we've been exposed to, both Dr. Adler and I, from the student population, from the landlords and the property owners, and Purdue, you could not have a more unified front for a very, very, very serious problem.
I think from my standpoint, I participated in the meeting with the Protect Purdue folks that we were at, and I think the big takeaways from us, we discussed the Purdue plan, and we also discussed what keeps each of us up at night as we worry about what could happen as the Purdue students come back and how we work as a whole community. And so I thought that meeting was very worthwhile, and I think for me the biggest takeaway from that was, how do we look at the Protect Purdue plan and encompassing that into the broader community, into Lafayette, West Lafayette, Tippecanoe County? How do we look at that pledge as it affects Purdue, but how it affects the rest of us? And can we extend the reach of that pledge with our businesses and with some others to, as we watch the numbers, and as Dr. Adler said, we're data-driven here. We make decisions off science and numbers, but I think that was the meeting I participated in, which was not John and Dr. Adler. There were two meetings. I didn't participate in the second one. But the first one I felt was good, and I think there is a spirit of cooperation. But I think there are things that all of us are going to have to do as the students come back in all of the communities to make sure that that's a safe return for them and a safe return for all of us. And I think in the coming weeks and months, that discussion will continue, and I think you'll see additional things come forward from these meetings.
Thank you.
Question from Facebook Live. Is there any policy in place to require testing of all employees when a case has been confirmed within a business?
There is not a policy that would require all employees to be tested in a place of business. Typically, what would happen, as it would in any other situation where somebody tests positive, is the contact tracing procedure would be put in place, and that procedure, that investigation, would identify individuals who may have been exposed, close contacts, and would also identify which of those individuals would need to be tested. So not necessarily everybody in a workplace setting, but likely the individuals who are determined to need that testing through the contact tracing and contact investigation.
This question is for the doctors. What instructions are given to healthcare workers given about mask wearing? I've seen employees from the hospitals and retail places not wearing masks.
So the expectation within our clinical facilities is that people wear masks all the time, from the moment they step in until the moment they leave. So we have, so that's all of our clinical facilities, hospitals, clinics, et cetera. The strong urging is, just as Dr. Adler has advised for all of us, is when you are out away from your work setting, you also, in public places where social distancing is difficult, are wearing a mask. So there's not an expectation for, we encourage employees to follow those guidelines when they're out about in the community.
Same for us. Within the facility, the requirement is to have a mask on as soon as you walk in the door and until you leave. And there are different requirements depending upon the clinical area that you might be in. There's some different requirements about masking and which type of mask you would wear in a different clinical environment. But we don't have a specific policy that would say you must, and that would be hard for us to manage and to enforce outside. But we'd encourage our employees to do exactly what we encourage the rest of the community to do, to do the same things. All of us do the same things.
Speaking with the health department Monday, I was told that the virus is starting to spread more in the Hispanic and Latino community. Just wondering why that is and what's being done to resolve the issue.
Sure, sure. Yes, one of the things that we have noticed over the last week or so is an increase in positive tests among the Hispanic population. Currently, the Hispanic population in our county accounts for 22.2% of our positive tests, so not an insignificant segment of our COVID-19 cases. What we as a health department have been doing to help address this is we have been reaching out to various businesses in town that serve many of our Hispanic community members, such as the grocery stores, the Mexican grocery stores, and have given them flyers and posters in Spanish to hang up in their places of business to help get the message out in Spanish. We've also posted that information on our health department website. We're also reaching out to some area churches who serve our Hispanic population and trying to distribute educational materials through those churches too.
Question from Dave Banger. What activities or trends have you seen in recent weeks that have concerned you, and what should be done about those?
Well, I think just like every other place in the state and in the country, as we're seeing more things reopen, more businesses reopen, more activities resume, we're seeing, of course, larger numbers of people gathering, and whenever there's a larger gathering of people, social distancing becomes difficult, and unfortunately, not everyone is choosing to wear face coverings when in these gatherings or when they're out in public settings such as stores. And so those are things that I think concern all of us because we've seen how easily this virus can spread. We've seen how many people who carry the virus are asymptomatic, so they have no symptoms at all. And so they could easily be passing this on to others who are in close proximity.
Question for Dr. Adler from Facebook Live. Do you think Purdue's plans in terms of testing students in the fall are sufficient for protecting the people in Tippecanoe County, and should they test all students?
The last I spoke to Purdue about that issue, they had not yet decided at that point on what their testing strategy would be from a screening standpoint. Would they be testing everybody? Would they be testing just certain groups of students? They were still working on that. The question about whether every student should be tested is a great question, and one of the limitations of that approach is that you could test everybody one day, and then the following day, students could be exposed and become infected, and yet the test that they had done would be negative because it was done before they were exposed. So it could lead to maybe a false sense of security. So there are issues to think about when it comes to whether everybody should be tested or not.
Question from Dave Banger. This week, Madison, Wisconsin closed indoor services at the city's bars after a large number of cases tracing back to those in recent weeks. Some said it was a necessary step to help the University of Wisconsin reopen. Have you considered similar moves, or do you believe that might be necessary here?
Well, I think, as we said earlier, any sort of decisions like that will be based on our local data. And so we'll be watching data such as that very closely. And, if situations arise where steps like that need to be taken, then I would say nothing is off the table. But again, it will be based on our local data and also, of course, careful consideration and consultation with our state health departments, leaders, and also our local elected officials.
Another question from Dave Banger. Has your confidence level in Purdue's reopening plan gotten stronger, or has it waned in any way in the past 2 weeks?
I think it remains the same. I think that Purdue's plan does a good job of putting into place measures that will be effective in classrooms, in campus buildings, residence halls, dining halls, places like that. Of course, the big question is what happens outside of campus and outside of those buildings, and how do you control for people's behaviors? And that's a more difficult question, and that's where we have to trust that people are going to do the right things, and they're going to listen to what experts are telling them. They're going to take the COVID-19 pandemic seriously and take all the steps that are necessary to protect themselves and to protect others in the community.
And to that point, the kids that are coming to school here have parents, and it's imperative that there's an understanding that we as cities, county, and as Purdue University are doing everything we can to make sure the appropriate precautions are being taken and that the new standards are being abided by. And they've experienced life without going to school. Parents have experienced the challenges that having somebody that you have had in your household for 18 years go away and being dependent upon an institution to maintain some form of control over their health and well-being. So it's a much bigger issue than just will they behave and are we going to be okay? This isn't an evil invading force. This isn't a group of people who are going to come here and intentionally do harm. They're smart, or they wouldn't be here in the first place. This isn't a new story. This has been around now for months. So they're informed to the point where they understand the repercussions of irresponsible behavior. And I think, and hopefully I'm not being Pollyanna-istic, but I hope that will make sure that this will keep any kind of irresponsible behavior or cross-contamination to a minimum. The other thing is that local governments, state governments, our local medical personnel, our media, we're all on the same page here. We're all basically communicating the same message. And it's that kind of collaboration that will help us keep our numbers down. Because again, not to segue into another issue, but because of our connectivity with each other and because of our collegial relationship and friendships with each other, we're all sending out the same message. And I think that really is going to help us in the end.
I'll react to that question. So the question was, are we more confident in Purdue's plan over the last 2 weeks? I agree with Dr. Adler. I think that Purdue's plan seems sound, and it's with every conversation, there's more specifics that are being applied to it. Where my opinion or my thoughts have evolved on this is real recognition that the community has an opportunity to really support a successful reopening of Purdue and of our other school systems by adhering to the guidelines that Dr. Adler has gone over weekly at this session. When I look at the Purdue plan, their expectations for mask wearing and social distancing, et cetera, on campus are really rigorous. And if you're in that environment during the day and you leave that environment and now come out into the broader community and you're seeing people not adhere to that level of rigorous infection control, you're going to drop your guard, whether you're a maturing adolescent or an older faculty member. It's going to be incumbent on the rest of the community to get behind what needs to be done to allow this influx of a large number of people to be done successfully so that we all can continue to enjoy the benefits of Purdue's reopening and the schools reopening and the restaurants and other businesses reopening.
A member of on the note of Purdue, a member of the health department said that a Purdue representative from the Safe Campus Task Force might be here today. Can we expect to hear a joint meeting anytime soon, anytime this month?
Yeah, we were hoping to have a representative here today. Purdue was unable to send somebody today, but our plan is to have somebody from one of the Purdue task forces with us at a future press briefing, yes.
Question from Facebook Live. The West Lafayette Golf Club is selling tickets to a 4th of July celebration for families. Did they ask for advice?
I'm not familiar with the West Lafayette Golf Club, so I don't believe so.
Not me.
Another question from Facebook Live. Will Purdue's flu vaccine requirements affect the quantities available at local doctors' offices?
You know, I don't know the answer to that question.
I'll jump in.
Yeah.
I mean,
Go ahead,
So
please.
the honest answer is I don't know it either. But what we do know is that the supply chain for vaccinations is, each organization has their companies they buy it from, and that's being pressured nationally now because many organizations are recognizing, wow, we want to make sure as many people as possible get flu vaccine, especially this year. So there may be an impact regionally, but not specifically because of Purdue's plan.
Another question from Facebook Live. Should employers that have employees who can work from home continue to utilize this advantage to help reduce the possibility of exposure?
Yes, I think that's a great idea. If you have employees who can carry out their work tasks from home, that is a great way to lessen the chances of COVID-19 transmission and help keep everybody at your workplace safe.
Another question from Facebook Live. Does Ivy Tech have a similar plan to reopening as Purdue?
I actually don't know the answer to that. I've not heard anything about Ivy Tech.
Another question to the mayors and Dr. Adler. What is going to institute a mask requirement for public spaces or indoor establishments? What data points?
What was the first part of the question?
What data points? This question's been asked about 12 times, so we're trying to combine them into one. At what point will the mayors and Dr. Adler want to require masks? What data points?
Yeah. So, as we've talked about at other press briefings, we follow actually a series of data points, not just one data point when it comes to COVID-19 here in Tippecanoe County. And we look at the trends in those data points, and if we see significant trends in an unfavorable direction in more than one of those data points, that would certainly warrant further discussion about what other measures could we do as a community to help curb the COVID-19 pandemic in the community. So it's going to be a data close monitoring of data and decisions driven by our local data.
I would concur with that and add to it just a little bit that, as Dr. Bean and everybody has said, that we cannot allow for us to go backwards when it comes to, our businesses and those types of things and our factories getting back up and running. And so if that means that we have to go to a mandatory mask policy to ensure that that doesn't happen, then that's something that is definitely on the table, because that is a small price to pay for having an economic shutdown reoccur in the community and the plethora of problems and issues that causes for people across the entire spectrum of our community in different ways. And so we will be watching those closely because we can't let this get out of hand where it could cause a significant issue like that that can really hurt people that are maybe just getting back on their feet, being able to pay their rent, being able to get back, having enough money to do some of the things, get their prescriptions, all kinds of things. And so we have to be sure that we're not letting ourselves slip into a situation that we begin to harm people like that. And if that means mask, then that means mask. And so the easiest thing to do is for everybody to take these recommendations seriously now, so we don't, we can control these data points to the best of our ability, because we are going to be using science to make these decisions. And as Dr. Bean said, as we look at how we work with Purdue to ensure that we're all doing the right thing, that we send a unified message between us and the students again, so we can absorb that influx of people and keep these numbers where they need to be to keep our economy humming along. And so I think, and everybody in the community has a stake in that, whether you believe in masks or not, or if somehow it's infringing upon your own personal freedoms. Everybody has a stake in the economy and keeping the economy moving in our community, and that's the way we need to look at it.
Thank you. I believe that is all of our questions